You have a 50-year-old female, short of breath.
Okay. Scene safe BSI?
Yes, the
Okay.
scene is safe.
Are there any environmental hazards?
None.
How many patients do I have?
1.
Or is there a need for additional resources?
No.
What's the nature of illness?
Shortness of breath.
Okay. Is there a need for extrication?
No need.
Is there a consideration for spinal mobilization?
No need for spinal mobilization.
Okay. General impression of the patient.
The general impression of the patient is poor.
The general impression of the patient is poor. I am gonna go ahead and assess the APU scale. Hi, ma'am. My name is Michelle. Can I help you? Okay. According to the APU scale, she's alert. Is there any apparent life threats?
No.
Okay. And her chief complaint is shortness of breath.
That is correct.
Okay. I'm going to go ahead and assess her airway.
Her airway is open and patent.
Okay. And her breathing is
As it appears, 20 to 30 times labored.
Okay. I'm going to go ahead and place the pulse oximeter on her finger. And what is the reading for my pulse oximeter?
88% on room air.
Okay. I will go ahead and provide 15 liters of oxygen via non-rebreather. Is there any major bleeding?
There is no major bleeding.
Okay. I'm going to assess skin signs. Okay. Her skin signs appear cool, pale, and diaphoretic.
That is correct.
Okay. And I am going to assess her pulse for 15 seconds. Okay, her pulse is regular at 120 and bounding.
Correct.
This patient is in immediate transport based on her SpO2 of 88% and a heart rate of 120. She's a high priority patient. She has a GCS of 15, so I'm going to go ahead and transport her. En route, I'm going to go ahead and ask her some questions. What were you doing when this shortness of breath started?
I was just in bed.
You were just in bed? Okay. Do you have any associated chest pain? No associated chest pain? Are you coughing anything up like phlegm?
Yes.
And what color is the phlegm?
Pink.
It's pink? And what's the amount? Is it small amounts or large amounts?
Small.
Small amounts? Okay. It appears the patient is talking in about 4 to 5 word sentences. Have you been diagnosed with any other diagnosis? What are they?
CHF, asthma,
Okay.
and hypertension.
Okay. And what medications are you taking?
Lisinopril, albuterol, and Lasix.
Okay. And do you think you can walk from here to the bathroom that's located over there? No? So your exercise tolerance has been decreased? Okay. Do you have any allergies?
No.
And you're taking lisinopril, albuterol, and Lasix. And you've been diagnosed with hypertension, asthma, and what was the third one?
CHF.
CHF. Okay. And what was your last oral intake?
Some pizza.
Some pizza?
Yeah.
Okay. And you're unable to walk to the bathroom that's located right here. I'm going to go ahead and do my focused assessment. Thank you. Go and breathe. Okay. Breathe. Breathe. Go ahead and breathe. Okay. Her lung sounds are decreased bilaterally with crackles at the bases.
That is correct.
Okay. I'm going to go ahead and do my full set of vitals. have a blood pressure of 200 over 100.
Correct.
Okay, and I continue to have a pulse of 120, rapid and regular, bounding and regular, and her breathing remains at 20 to 30, labored. Ma'am, is the oxygen helping you that I gave you?
Yes.
Yes, it is. Their oxygen saturation right now is 94% on 15 liters. I will go ahead and state my general impression of this patient. I believe that my patient is having an episode of congestive heart failure right now due to her shortness of breath and based on my assessment of crackles and decreased lung sounds. The oxygen is helping her, but I am thinking that she's having another episode of that. The oxygen that I provided did help. She says she feels better even though her breathing is still at 20 to 30, so I'm going to make sure to reassess. I will go ahead now and perform my head to toe. Okay, I'm going to palpate your head. Any pain? No? Okay. There's no drainage, no bleeding from her ears. Do you have any pain here? Any pain here?
No.
No? I'm going to assess her trachea, make sure that there's no tracheal deviation, assess for JVD, assess for any stomas, medical alerts. There's equal rise and fall of the chest. Do you have any pain here?
No.
No? No pain?
No.
So there's no step-offs, no crepitus there. Okay, go ahead and take a big breath in. Okay, it's equal. Breathe. Okay. I still hear crackles at bilateral bases with a slight decrease bilaterally. Okay, let me know if this is hurting you. Does it hurt?
No.
Any pain? Any pain?
No.
No pain? Okay. Any pain here?
No.
No? Okay, there's no blood or drainage in the perineum. Okay, I'm assessing for any edema or swelling, which in her case, I could see some edema. You can go to this leg. Any pain?
No.
No? Let me see if you have any swelling or edema. According to my assessment, she has bilateral edema. I'm going to assess for pulses.
Present.
They're present. Okay, go ahead, wiggle your toes for me. Okay, push down, push up. And which toe am I touching?
The big toe.
Okay, and then I could also assess at this time her cap refill. Her cap refill is delayed. Okay. Now I will go ahead and give my report. Okay, so I have a 50-year-old female that was complaining of shortness of breath. Her general impression was poor when I arrived. She was alert on the AVPU scale. There was no apparent life threats. Her airway was patent. Her breathing was labored between 20 and 30. I provided her with 15 liters non-rebreather. Initially, she was sitting at 88% on room air. After I provided her with oxygen, it came back up to 94%. There was no active bleeding noted. Her skin signs were cool, pale, diaphoretic. She had a strong bounding pulse of 120. And we transported her as a high priority patient. She said that her shortness of breath started while she was sitting down.
Yes.
Yeah, there was no associated chest pain. She's been coughing up, I think she said pink sputum. And she was talking about 4 to 5 word sentences. She takes medication for hypertension, asthma, and CHF. Those medications are albuterol, Lasix, and lisinopril. Her exercise tolerance has decreased. She was unable to walk from her bed to the bathroom that was located nearby. On my assessment, I found that her lung sounds had bilateral crackles and also decreased. She did have bilateral lower extremity edema, and her cap refill was delayed at 2 seconds, greater than 2 seconds. Her vital signs were 200/100, heart rate of 120. Her breathing continues to be labored from 20 to 30. And I would reassess every 5 minutes, assessing my primary, secondary, vital signs, and any interventions.